Armed with a state-of-the-art technology and comprehensive multidisciplinary team of breast health specialists, Jordan Hospital opened a new breast center this weekend. Dr. Dominic Zazzarinos, who has championed the project, spoke recently about the breast center's effect on comprehensive care.
There are basically two types of mammogram. A screening mammogram, that's a woman who just comes in for a yearly exam. She's not aware of any problem in terms of a physical finding, and something may or may not be discovered on her mammogram. If her mammogram is normal, great. If her mammogram is abnormal, then she's culled out of the system.
Okay.
So that a workup can begin. It may require additional diagnostic tests. It could require an ultrasound. It may require additional mammographic images, and it may eventually even require an MRI. But then she has the ability, if that problem is not solved and we can say, okay, it was a mammographic abnormality, but the problem is a benign problem, then she may just see me in clinic for a clinical exam and then be recommended for additional follow-up.
Okay.
Now, if a person comes in with a significant problem, that's called a diagnostic mammogram. If we find something, that patient is culled out of the system and then meets the breast navigator as well as myself within 24 to 48 hours, and the workup proceeds immediately, including biopsy. If we have the biopsy in general, if a patient's not on blood thinners, and we can do the biopsy either that day or the next day, within 48 hours, 70% of these patients have their diagnosis. So they will be able to meet with me when I tell them the official diagnosis. If there are special studies that need to be done, because there's going to be 25% of patients who are going to need other studies, whether it be immunohistochemistry, etc. That usually takes 4 or 5 more days. But our goal is to have a diagnosis, whether it's benign or malignant, on a biopsy within 5 business days. That's a goal.
Wow. Is that similar to what it was before, just more streamlined?
We've been able to do the same thing before, but we were never able to be in one location, and having mammography here obviously is much different than being in another office and having to schedule it. So that would lead to a few days extra to make a booking.